Now, according to the Lagos State Commissioner for Health, the state has so far conducted over 64,000 tests. 231 of the confirmed cases have since been discharged excuse me, from the COVID-19 care centers following full recovery. Now, according to Professor Akin Bayomi, the Health Commissioner in Lagos, 11,128 of the confirmed cases are monitored in communities by the COVID-19 Lagos response. He said that 87 of the cases are currently under isolation in public and private care centers, while 1,744 active cases are in communities, and they are yet to turn up for admission in the COVID-19 Lagos care centers. We have Dr. Ante, a Lagos physician, also a general physician, who joins us here in the studio. Thank you for joining us on the program.
Thank you very much for having me.
Okay, so let's talk community transmission of the virus. But I'd like to start with what used to be and what is now as a general physician in Lagos. A lot has changed, hasn't it?
Yes, a lot has changed, like not just in the health sector, like everywhere. A lot has changed. You have to be like more vigilant when you're attending to patients. You have to like look out for the signs, the symptoms. Even then, you also have to bear in mind that some people are asymptomatic as well. So it should also guide your mode of treating patients.
Okay, so first, as you know, assessing the readiness and compliance levels, a lot of people have been talking about the recent numbers we've been seeing. And if you notice as well, the FCT has sort of been topping the numbers we've also been seeing. And it seems Lagos, compared July and June figures, seem to have dropped. So do you think that Lagos will peak in this month, August?
So honestly, I feel it's dependent on how many tests are being carried out. So we are now in a situation whereby everybody's out on the street, everybody's back, almost like Lagos is almost fully open, if I may say. So you necessarily cannot really use like the figures you're getting to judge what we currently have on ground. And people don't really believe that the virus is there. So a lot of people don't even bother getting tested. And I believe people are just going back. But when it comes to the peaking, I can't really say if it's going to like go back. But we've seen in other cities, like other places outside Nigeria, where their curve goes down, and then at another point it now has like a second wave.
People wonder, yes.
So I'm really hoping that that doesn't happen here, because like people are tired already, and our compliance level is really low. So that would also affect.
So we've also had eateries and restaurants that may open, of course, with certain restrictions in place. A lot of people have been talking about the reopening of worship centers this weekend. Many people looking forward to that. But some have also said that doesn't that increase the public gathering capacity?
Then I feel the people that are saying doesn't it increase should actually go out on the streets. You see at bus stations, even the so-called 60% capacity for vehicles are not being maintained. So I feel if every other sector is open, I don't see the reason why religious centers should be closed.
That's because markets
are open. Everywhere is open. So I don't see a reason why they should be left out.
So let's talk about the use of the fabric face mask. Now, the World Health Organization said it should be at least 3 layers in between. What do you think? Because we have many that a lot of people are using.
People just sew anything and put it out. But one I saw, which has like a filter in between, just trying to like limit the rate at which, for instance, if you use the normal cloth mask, like just a layer of material, it's easier for like the virus to maybe just pass through one of the, because it's fenestrated a little bit, but even if it's closed. So it's easier for you to still breathe it in. But if you're using something that has 3 layers, then you have like multiple layers of protection as regards just having a single layer of protection.
So far we have exit students coming back to school. A lot of people are excited about that. And, you know, the word is caution, caution. What's your advice?
My advice is, first of all, I feel this period should have actually made us adapt, like technology-wise. If you look, a lot of things have gone into the virtual space. So I feel education should have gotten there. But, you know, we have like some challenges in our own system. So people can't actually write exams at home. They can't actually do, so we still need to have that physical presence. Apart from private institutions, I know some private universities, even like secondary schools, they do their exams and online. But we know that our government facilities they don't have that. But I feel this should have been a wake-up call. But, I mean, it's past, and they need to actually move forward, because staying in a level for that long could actually have some psychological impact at the end.
All right, we appreciate your time. Thank you so much, General Physician, Dr. Ante. Thank you for joining us. We have more on the COVID-19 update when we return. Please stay with us.